has been my passion for about the last 15 years. I knew when I was in nursing school that what I really wanted to do was work with women. I didn't have any desire in working in the hospital because I didn't want to work with sick people. And a lot of my colleagues at that time would say, why are you in nursing school if you really don't want to work with sick people? Well, I love working with women, and I realized that women need help, but they don't necessarily have to be ill to the point where we're in the hospital in order to help them. Although sometimes they feel like they could be in the hospital, and they oftentimes come in and say, why don't you just put me in the hospital for a couple of days so I feel better? But that's not what they really need. So today I'm hoping to go through a lot of information with you to provide you with some tools that you can take back to your practice on Monday and actually utilize in helping women feel better from a menopausal or perimenopausal perspective. Okay. Okay, maybe that's not going to work. There we go. So I told you a little bit about me. I am an integrative medicine practitioner. I became an integrative medicine practitioner about, 10 years ago, I believe it was now, when I became ill myself. And at the time, no one could help me figure out what was going on. And at that time, I saw my primary care doctor, and he said, well, you've got one of two things, fibromyalgia or MS, and I really can't help you with either one. So here's a prescription for some narcotics, here's a prescription for some Prozac, and in the next 4 years, you're going to be disabled, so just get your life in order and be prepared. And I went home and fell apart in my husband's arms and said, this can't possibly be true. There's no way that at 28, I can live like this. So at the time, I was working at Planned Parenthood, and I had some different friends, wacky friends. They did things differently than what we were trained to do. And at that time, I realized that if I was going to survive, I needed to find those people, and they had connections with people that could help me. And that's exactly what they did. And I'm grateful for them every single day of my life, that they turned me on to some integrative approaches. They brought me to people, dragged me to people sometimes, and said, here, you need to do what these people tell you, and you'll get better. And it wasn't 6 months after doing some integrative practices that I didn't have any of the symptoms that this doctor told me I had. And I realized at that point that, wow, if I could easily be misdiagnosed and be treated this way, how many other people are being treated like this as well? And for me, that was my desire at that time to say, I need to learn more about this so I can provide this information for my patients as well. So that's really where some of my passion stems from. Some of my fears